Excellencies, co-chairs and commissioners, ladies and gentlemen, I would like to welcome you to the launch of the report of the Independent High-Level Commission on NCDs, which was established by the Director General of the World Health Organization, Dr. Tedros, last year. Non-communicable diseases are the rage around the world. This is a global health crisis. And we are here today to hear these commissioners' recommendations for action in all countries can take now to mitigate the crisis and to move towards the achievement of the Sustainable Development Goals. I would like to thank the co-chairs who guided the process and all commissioners for their hard work and important contribution for this report. And we are especially grateful for Richard Horton, editor of The Lancet, who has published the report in the journal today. Richard was meant to be with us today, but his flight was cancelled. And I would like to give the floor to the Dr. Etienne Crook, the Director of the Department for Management of Non-Communicable Diseases, Disability, Violence and Injury Prevention. Etienne.
Thank you very much, Svetlana, Your Excellency, DG. Good afternoon. Indeed, I will be your Richard Horton this afternoon with a Belgian accent. Since we have a very packed agenda, I'd like to move straight on to our first speaker and introduce Ms. Zoleka Mandela. Zoleka is an activist, author, and founder of the Zoleka Mandela Foundation. She also knows firsthand an NCD since she is a survivor of cancer. Zoleka.
I'd like us all to please stand, and if you would all join me, just to keep in memory all those who have succumbed to NCDs. Just a moment of silence, please. Thank you. Your Excellency, President of Uruguay, Dr. Vasquez, Director General of WHO, Dr. Tedros Adhanom, Ministers, Honorable Members of the Commission, distinguished guests, ladies and gentlemen. May I firstly thank the World Health Organization for the privilege of speaking here today, as well as the High-Level Commission on NCDs for launching this very important report. It is a great honor to be amongst you all here in Geneva at the WHO Independent High-Level Commission report launch on non-communicable diseases. Most of all, I am humbled to be able to speak to such a distinguished audience of heads of states, ministers, entrepreneurs, leaders in health and development. There is no pretending that I'm anywhere near as qualified as everyone here to speak, but what I would like to do today is speak from my experience and to speak about what is important to me and to all who have gathered here today: our health, our children, and our future. I believe that those of us who have survived must tell our stories if we're going to effect some kind of change in the world. So please do allow me to tell you a brief part of my story. But firstly, I must say that breast cancer is in fact an emerging health problem that is particularly feared by many women across the globe. The incidence of this life-threatening disease is rising in South Africa as it continues to affect a significant number of men and women in my country. Cancer kills millions each year, and more than 2/3 of deaths are in developing countries. I was diagnosed with breast cancer in 2012 at the age of 32. It was 9 months after my son passed away due to an infection I had developed in my womb that ultimately led to his premature birth. I, at the time, was of the belief that the medication that was prescribed by my doctor to stop milk production was the result of a lump I had discovered in my left breast. In the months leading to 16 cycles of chemotherapy over a period of 6 months, at a private teaching hospital, I underwent a bilateral mastectomy with immediate reconstruction after a left sentinel biopsy determined that I had been living with the hormone-positive breast cancer unknowingly for a period of 8 to 9 months. A multidisciplinary team who comprised of some of the country's best medical specialists who were all relevant to my treatment and to my care, together with the support I received from my family and my friends, certainly brought into my life light and especially hope in the days that I fell into the hole of darkness and despair. 3 months after my last chemotherapy treatment, I conceived naturally, in spite of a trip to a local fertility clinic for the purpose of egg and embryo preservation prior to chemotherapy. I was lucky. The reality is that millions who don't have access to good health care are not as lucky and so don't have a chance to survive. Millions remain silenced and don't have the powerful opportunity to share their personal stories as I am doing today. All women and men who are diagnosed with NCDs such as cancer ought to have equal opportunities for early diagnosis and access to treatment, but millions of people in Africa and other developing countries are not afforded the opportunities of an efficient health system. The global burden of NCDs is said to be on the rise, specifically in low and middle-income countries, resulting in more suffering and an even greater need for medical care. Without screening and treatment, the number of deaths in women will increase if the challenges pertaining to access and quality of care are not improved. I was re-diagnosed with cancer for the second time in 2016 at the age of 36. Early detection, known to generally increase the chances for successful treatment, had saved my life again. Access to treatment saved my life again. My privileges continue to place me at an advantage over the lives of those who face far too many hurdles in order to receive the best medical care and proper treatment that I was able to receive. I was fortunate. I managed to get detected and diagnosed early enough. I also received great medical care and proper treatment. Many are not as fortunate as I was to have been diagnosed early and are constantly faced with the reality of very poor health outcomes. Back home in South Africa, I have been inspired to help others who suffer from breast cancer. In an attempt to raise awareness, the importance of early detection, on survivorship, and to reduce stigmatization of breast cancer, the Zolega Mandela Foundation was launched in 2012. For example, the Foundation Refreshment Distribution has afforded its volunteers an opportunity to cater to over 10,000 cancer patients receiving chemotherapy treatments at a local public hospital in South Africa. The core focus area of the Foundation are the reality of my own personal struggles and that of my experiences with drug and alcohol addiction, with breast cancer, with sexual and physical abuse, and as well as with road death and injury. These personal encounters that are very difficult truths that I have shared in my autobiography, When Hope Whispers, are an attempt to instill hope in the lives of those like me who have suffered at the hands of social ills that continue to plague many communities across the globe and rob the lives of the innocent and the vulnerable. Many women in South Africa are unaware of their breast cancer risk. Some fear diagnosis, while others may not recognize the seriousness of their symptoms. I had refused breast cancer treatment soon after I was diagnosed, as I was afraid, feeling helpless, and I was in denial, with very limited breast cancer knowledge and awareness. I was of the belief that breast cancer was a death sentence, overlooking the reality that basic medical care is a privilege, and that if treated and diagnosed early, the chances of survival can be improved. From my own experience and the precious lessons both my late grandparents imparted, I know the importance of being expressive and the impact that has on inspiring other women to be more comfortable doing so themselves, so they too can make positive changes in their lives and in the lives of others. It is quite hard to believe that living in the 21st century, we still fail to confront this preventable epidemic. In June of 2010, my daughter Zenani was killed by a drunk driver just 2 days after her 13th birthday. And as my family was thrust into inconceivable despair, Millions of other children were killed or injured due to this violation towards our children. Road crashes, much like NCDs, are avoidable killers and are a very cruel health burden that continues to infringe on the basic human rights of the vulnerable. We cannot allow this avoidable suffering to continue. I find comfort and strength in the words that my grandfather once said to me in the days that I was grieving the loss of my daughter. He said, "Darling, you are not the only one who has lost a child. I have lost a child, and many people have. But for you, it is so that you can bring hope to many." The report being launched today is an important start that sets out a pathway for action. At the UN High-Level Summit on NCDs in September, our leaders must respond. They must please step up and finally act. With one voice, we must all say, enough. We need stronger commitment and action from our leaders to improve our health systems in order to achieve better health outcomes for all, to no longer ignore the health burden that continues to destroy the lives of innocent children around the world. We must help the vulnerable find hope in their darkness. We can and we must strive to do better. Our leaders need to take decisive action to prevent and control non-communicable diseases so that lives are finally saved. I am joining the campaign and I am saying enough to non-communicable diseases. Enough to these preventable epidemics, both NCDs and road traffic injury. We can and we must defeat them for our health. We must not fail, not for our future and that of our children. Thank you.
So much, Soleka, for speaking so eloquently about your personal story and about the many millions around the world who are not so fortunate to be the granddaughter of Nelson Mandela and who don't have the access to diagnosis and treatment as you did. Thank you very much for kicking off this discussion with such an important plea. We're very honored to have with us President Tabaré Vázquez, the President of Uruguay, who is one of the co-chairs and leaders of the WHO Independent High-Level Commission on NCDs, and who will now hand over the report to Dr. Tedros after many months of work. Señor Presidente, usted tiene la palabra.
You have the floor, President.
Muy buenos días.
A very good morning to all of you. Ladies and gentlemen, Director General of the WHO, Dr. Tedros Adhanom Ghebreyesus, co-chairs of the Independent High-Level Commission on Non-Communicable Diseases, ladies and gentlemen. Well, life has taught me that where there's a will, there's a way. And the report we are launching today has been drawn up by a commission that was created 7 months ago at the request of the WHO Director General. A commission composed of persons with a great interest in the issue of non-communicable diseases, and people from places as far away as Pakistan, Finland, and Uruguay in the far south of this world. Well, I was just saying a moment ago, before this session, that the process of drawing up this report didn't require any summits or comings and goings of high-level experts or officials. Indeed, there were no ceremonies in the process. And one thing that we should also remember is that it didn't even appear in the headlines, in the newspapers, because it would seem not to be an issue of high-impact news for the press. regrettably, unfortunately, NCDs isn't big news. But what it did require, this process, was something that we all have in common here today. And that is conviction, commitment, and determination. And I think that should be big news. Indeed, it's very positive news, not for us, but because of the content, the work of the Commission, and the objectives that it set. The report tries to achieve the objective set for the Commission. The Commission I had a great honour to take part in. Draw up and compile a record of innovative and ambitious initiatives to prevent and control NCDs. And a report designed to renovate the commitment, renew the commitment of states in the run-up to the third high-level meeting of the UN General Assembly on NCDs, which, as you know, will take place in September this year during the UN General Assembly. And we believe that this is vital if we are to achieve the 9 voluntary global targets on non-communicable diseases. And indeed, Sustainable Development Goal 3.4 by 2030. Namely, to reduce by 1/3 premature mortality from NCDs through prevention and treatment, as Zolega Mandela was saying just a few minutes ago. And very modestly, I would urge you to think very carefully about that. Because there are just 12 years to go to 2030. And how far do we still have to go to achieve these goals? I don't think this is the time or the place to take stock of all of the figures. But I do think that this is the time and the place to urge all of you to redouble your efforts to try to achieve those targets, because otherwise we are just not going to achieve them. And that is our shared responsibility. As I was saying a moment ago, I am a trained doctor and also a political leader. And it's true that diseases are something for doctors. But public health is a responsibility for all, for society as a whole. Well, some might say that these targets are very ambitious, and that the current global situation is very difficult. There are great expectations and not a wealth of resources. But yes, they are ambitious goals. But they must be ambitious when you take into account that non-communicable diseases kill some 40 million people a year around the world. And that is a figure far greater than the number of people who died in the 2 world wars last century. And that's something we need to think about. 15 million of these deaths affect people between the ages of 30 and 69 years of age. And low and middle income countries are particularly affected by non-communicable diseases, because more than 80% of deaths caused by NCDs are in such countries. So the goals aren't just ambitious, they are also progressive in terms of aiming for healthy lives, equal opportunities, genuine possibilities of access to healthcare services, social cohesion, the strengthening of democratic institutions, and in particular, human development for people all over this planet. Everything is interrelated. This is complex, but that is the reality that we are facing. Some might say that the world is too complicated. It is complicated, but of course it always has been. Do you think the world was really such an idyllic place in the past? If we were to wait for the optimal conditions for everything to be perfect before we took action, then we wouldn't achieve anything. In fact, protecting and improving people's quality of life also means improving human dignity, which is vital if we are to make progress in achieving economic growth, social justice, and peaceful coexistence. Health is also a factor of peace and democracy. Some might say that the demands outweigh the available financial resources, but let's think about that for a moment. How much does an F-35 fighter jet cost? Well, according to data from the Pentagon, some $80 million per jet. And what is the annual budget of Real Madrid Football Club from Spain? Well, in 2010, Real Madrid's budget was 100 million euros more than that of the International Atomic Energy Agency. Now, what this tells us is that the resources are there, and we need to insist and ensure that those resources are spent as wisely as possible to bring quality lives to all over the planet, leaving nobody behind, because there's no point in some of us moving forward, leaving others behind. Society is a whole, and if part of that whole is sick, then society as a whole is sick. So let's look at the economic impact of non-communicable diseases in our countries. Well, current calculations indicate that accumulated economic losses of lower and middle income countries go beyond $7 billion between 2011 and 2015. And those figures are from a PAHO report conducted in 2017 on the burden of NCDs on economies of countries in my region, Latin America and the Caribbean. We're not talking about spending a great deal. What we're doing is what we're talking about is investing better and ensuring that resources are spent on improving the dignity of our people's lives. If we take into account available figures, today around the world, 104,109 people will die as a result of non-communicable diseases, mostly linked to the high risk factors that have been mentioned already today and that we all are very familiar with. So isn't it therefore imperative to design and implement strategies to control alcohol consumption and tobacco use, to promote healthy lifestyles, including a healthy diet and physical exercise? I know this isn't a medical college or a scientific symposium, but as a political leader, I haven't forgotten my medical training, and I continue to be very interested in these issues. And allow me to say that you cannot design or implement strategies without trying to ensure that they have positive results. And as I said earlier, where there's a will, there's a way. These strategies aren't just for the health sector, because they also have a strong social and educational component, because tobacco control, for example, must begin at home and in schools as early as possible. It's always better, of course, not to start to smoke, than to stop smoking. And that's a dilemma, like many others that we face over our lives, that we're faced with at a very early age. So that's why education and public information are of key importance. And that's why I was saying health is a problem for all of us. These strategies aren't simple or easy, but they are vital. And as I said earlier, they can achieve impressive results. Maybe we'll never manage to eradicate these epidemics entirely, but we can always try to take incremental steps towards that objective. That isn't a pipe dream. That is an enormous shared responsibility for all of us. So, Director General, ladies and gentlemen, here is the report that was requested. And personally speaking, allow me to say how pleased I was to take part in the work of this Commission. I'm very grateful for the possibility that has been given me, and I would like to thank all of those who have helped in this important task. I think I'm right in saying that the Commission is submitting this report with a sense of satisfaction of a job well done, but also with a sense of confidence going forward. We are confident that this will be a vital input, a useful input, for the third high-level meeting of the UN General Assembly on NCDs next September. We also trust that that's a meeting that will lead to agreements and practical solutions to reduce by 1/3 premature mortality from NCDs, as was established in the Sustainable Development Goals and the 2030 Agenda. We trust that these agreements and actions will be implemented by the world's governments, and that they won't remain a dead letter. As I said, states and governments need to implement these agreements, but not only states and governments, because health isn't just a medical issue. Improving people's quality of life is a matter for society as a whole. And we also trust in society. And very modestly, I fully trust that the work of this organization and the men and women who work for it, with great conviction and determination, will continue to fight to ensure that we do our utmost to combat NCDs. We might not be talking about huge sums of money moving forward in this agenda, but with greater information and education for our peoples, and managing to ensure that everybody is on board, I'm sure we will make progress and try to achieve the objectives that we all have. Thank you.
Muchísimas gracias, señor.
Thank you very much indeed, President, for that excellent speech, and thank you very much for your commitment to health. If all heads of state had that same level of commitment, then we would be far closer to achieving Goal 34.
One of the co-chairs of the Commission who spent a huge amount of time in leading the work and developing the report, Sanja Nishtar, to learn more about its content.
Your Excellency, President Tabare Vasque, Minister Matela, Deputy Minister Salagai, my friend Tedros, Zuleka Mandela, distinguished guests from permanent missions, Excellencies, Commissioners, ladies and gentlemen. On behalf of all the co-chairs, it is today our proud privilege to present the report to the Director General of the World Health Organization. As you all know, this report is being launched on the eve of the negotiations, which are going to kick off next week in the run-up to the third UN high-level meeting on NCDs on the 27th of September. We have had, as a Commission, 3 months to turn around this report, which is a very ambitious turnaround to get a group consensus from such a wide constituency of viewpoints. And during this time, the Commission has had several virtual meetings. We've met once face-to-face in this very room. We convened a group of experts for a technical consultation. We put our report in the public domain to solicit wider inputs. The Commissioners have turned around several iterations of the report with their comments, and the Secretariat has facilitated us virtually 24/7, for which I'm extremely thankful to you. I wish to thank all the Commissioners and those who provided inputs. The report which you have in front of you is the product of their efforts. The report also reflects the outcome of a collaborative process to find a common ground and to convert such concordance into new recommendations. Given the composition of the Commission, which in addition to experts also included representatives of WHO member states at very high levels, there was, of course, disagreement and divergence of views in some matters. Let me quickly give you an upshot of the Commission's recommendations. First and foremost is the Commission, I beg your pardon, is the recommendation for WHO to prioritize NCDs given its enormous leverage to impact change in the developing countries. We know that there is a huge demand from countries for support to address NCDs, and this is also evidenced by data from the country cooperation strategies in more than 150 countries. But this has not cascaded into budgetary realities. In order to address this huge gap, donors and member states will have to step up their contributions to WHO for NCDs so that WHO can meet the rapidly increasing demand for country support. Secondly, there is a strong recommendation on political leadership explicitly stating that the responsibility for NCDs cannot solely be delegated to ministries of health, and that heads of state must play a key role given the multisectoral construct of the needed response. To be successful, NCDs need to be plugged into universal health coverage plans, into primary health care reorientation initiatives, into long-term national development plans, into SDG implementation roadmaps, in social protection policies, into resilience initiatives, into national metrics, reporting and accountability frameworks. There are various government approaches that need to come into play, ranging from regulation, taxation, subsidies and disincentives and incentives to investments and public health programming and behavioral nudges. The Commission believes that this wide-ranging agenda has implications for responsibility at various levels of government, and it is critical for commitment to flow right from the top. In the third place, the Commission calls for the integration of NCDs and mental health into country scale-up of universal health coverage. We strongly feel that it would be a tragic missed opportunity if universal health coverage plans in countries fail to address the world's leading killer. We could end up undermining the economic viability of universal health coverage if that was the case. In the fourth place, the Commission has called for the establishment of an independent accountability mechanism modeled on the Countdown 2030 for maternal and child health. We believe this would represent a quantum change from the current self-reporting model of accountability. The Commission also recommends that countries prioritize action because that is key to achieving the scale-up that countries need to reach the Sustainable Development Goal 3.4. At the same time, we have emphasized that there is a need to translate these priorities into bold political action in order to protect public policy from undue influence. Ladies and gentlemen, the 2011 political declaration on NCDs called for engagement with the private sector, but progress has been very slow. Hence, our Commission considers a fresh approach. We encourage governments to engage with the private sector based on the health is the priority principle. WHO has been asked both to support this engagement as well as facilitate regulatory action and consider the establishment of an international code of conduct to restrict the marketing of unhealthy products. The Commission has recommended that we tap the expertise of marketing experts and behavioral economists for designing public health campaigns for a new era, and that we engage the civil society and patient groups optimally. In terms of measures to foster public-private engagement, the Commission has called for 2 institutional structures. The first is the establishment of a health forum for investors so that the health community can engage with investors, investment companies, money managers, and financial institutions to encourage the shift towards investments in healthier portfolios. Secondly, we have called for the establishment of a forum so that stakeholders can come together on specific solutions to reduce the burden of NCDs. We recognized as a Commission that digital technologies, in particular the near ubiquitous use of mobile phones, has ushered in a societal transformation that can be tapped for better health outcomes. Emerging 5G and 6G technologies, artificial intelligence, robotics, blockchain, and the use of drones is shaping the future of healthcare in ways that is particularly relevant for NCDs, and it is critical that we stay ahead of the curve. Ladies and gentlemen, the Commission also emphasized the need for a new economic paradigm for NCDs. We have called for full cost accounting of the total societal burden of NCDs and for the integration of NCDs into human capital ranking and development indices, which are likely to dictate countries' borrowing costs as soon as 2025. The Commission recognizes that domestic financing for NCDs should be the mainstay, but in addition, we strongly feel the need for global catalytic support. And for that, we recommend a multi-donor NCDs trust fund and ways of collecting global solidarity levies on tobacco and alcohol. We have additionally called on international financing institutions and have encouraged them to lend for NCDs. Countries have been encouraged to raise taxes on tobacco and alcohol and consider consider evidence-based fiscal measures for other unhealthy products. As we all know, these are both revenue-generating as well as health-promoting. Ladies and gentlemen, here I would also like to convey that some recommendations did not receive consensus yet, and thus were not included in the report. In particular, a tax on sugar-sweetened beverages and the accountability of the private sector. Despite this agreement, the Commission has put forward, we believe, a bold agenda. Ladies and gentlemen, we have known about the burden of NCDs in crystal clear terms for at least the last 3 decades. For over half a century, we have known about the consequences of unaddressed non-communicable diseases and their risks. Strokes, many forms of blindness, heart failure, end-stage renal disease, amputations, gangrenous legs, disfiguring preventable cancers, the crippling effects of obesity, and the devastation that injuries cause and cancer causes is outlined by our dear friend Zulekha. Many of us have seen firsthand the suffering, the disability, the impoverishment, the loss, the opportunity costs, and the caregiver's burden. But never before in the history of public health has there been such a wide chasm between the knowledge of what exists and the solutions to prevent and address it, and the systemic inattention to a public health agenda on the other. In effect, NCDs have been the blind spot of global health. I don't wish to attack personal lifestyle choices here. We do not wish to attack corporate interests or the reticence of the global system to have a coordinated institutional response to NCDs. We only wish to convey that this is unacceptable and that we must turn the page. The rising tide of NCDs has put the public health community through its toughest test ever. We are tasked with a huge challenge. We are tasked with a challenge to bring a societal transformation and influence a wide range of actors. From multinationals that sell billions of products a day to the street hawker who will decide how to use the salt shaker. From the parliamentarian who needs to sign off on a tax reform bill to the village elder who will decide whether girls in his community will engage in physical activity. From the 40 million health workers who need to embrace, amongst other things, opportunistic of high blood pressure, to the minister who must learn to sign on and tick off on the NCD box on every transaction, and the finance minister who must diversify revenue streams while at the same time get better at revenue mobilization. This is a huge agenda. But this is not an agenda and not a battle that can be won by vilifying others or creating an overly simplistic enemy narrative. We believe, and I believe, especially with my work with people affected by NCDs, that we must look to ourselves to provide the solutions first. As someone famously said, we are the ones we have been waiting for. We must accelerate action now and accept this is a huge problem that has suffered neglect for decades. I wish to thank you, Dr. Tedros, for giving me the opportunity to co-lead this commission. I wish to thank my fellow co-chairs, and on behalf of the co-chairs, I wish to thank all the commissioners. And lastly, I wish to thank the Secretariat, without whose help this truly would have been impossible. Thank you very much.
Thank you very much, Sania, for your hard work on this report. And now that the content of the report has been unveiled, I'd like to invite President Tabare Vázquez to hand over officially a copy of the report on behalf of the Commission to Dr. Tedros.
Thank you. Thank you. Thank you very much.
Thank you very much, Mr. President. And we'll now hear from the co-chairs. This commission wouldn't have been possible without strong support from many different corners of the world. President of Finland is one of the co-chairs, and we're fortunate to have with us Minister of Social Affairs and Health of Finland, Pirkko Mattila.
Microphone for the speaker, please.
Excuse me, the microphone.
Now. Yeah. Thank you. Honorable President Vázquez, Director General, Your Excellencies, ladies and gentlemen, on behalf of President Sauli Niinistö, I would like to thank all commissioners for sharing inspiring ideas on prevention and control on NCDs and mental health. It's a great pleasure and honor to be here to launch these recommendations. Special thanks go to Dr. Sania Nistar, other co-chairs, commissioners, and WHO Secretariat for their hard work on this spring. Compiling bold and actionable recommendations for governments to scale up action was not an easy task. You all know it. There were a multitude of good proposals, useful approaches and practical tools. The challenge was to focus on recommendations that could have most impact on a global scale, but also help those left behind to leapfrog. We know that there are huge differences in disease burden between countries and different socio-economic groups. Most governments need help with challenges posed by NCDs on well-being, productivity and equity. It was clear that we needed to have a strategic approach that fits into different contexts from global to local level. It is important that high-level political leaders in individual countries lead the process. They need to take the ownership and set priorities based on local public health needs. One size does not fit all. I think that we have succeeded well in this work. I am particularly happy that the report emphasizes the importance of tackling socio-economic inequalities using tools like health impact assessment in different sectors and transforming health systems towards more integration, health promotion and public health work. However, it is up to governments to choose their tools. In Finland, we use both soft and regulatory measures. These include taxes for alcohol, tobacco and soft drinks, free or subsidized healthy meals in schools and workplaces, health education for everyone and lifestyle support to all families with children. And we have been highly successful with our approach. We can all learn from each other's experiences. I want to thank everyone who has contributed to this process, including our expert group and more than 200 responses received during open consultation. Your input has been highly valuable. I invite you all to contribute to implementation of the recommendations and to participate in the high-level NCD meeting at UN General Assembly in September. We hope that our recommendations will have positive impact on the outcome of the high-level meeting and eventually on the burden of disease from NCDs globally. Thank you for your attention.
Thank you very much, Minister, for coming all the way for your remarks, as well as for the strong support Finland has put into the work of this Commission. We're now going to hear from the third Head of State Commission. It's the President of Sri Lanka, who has sent us a video message, His Excellency Maithripala Sirisena.
Ayubowan, dear Dr. Tedros, fellow co-chairs and commissioners, ladies and gentlemen. I regret that I am not here with you today. However, I thank all the participants in this important meeting in Geneva. It is indeed an honor for me to be a co-chair of this high-level forum. The report of the Independent High-Level Commission is very timely. The recommendations reflect the urgency of fulfilling the commitment we have already made. At the same time, they suggest some important practical solutions to scale up action. These recommendations will guide me and my fellow heads of state and government on how to take further actions to tackle this global health crisis. In Sri Lanka, we have made a good deal of progress in primary health care, with NCDs now fully integrated into it. Yet, we still face many challenges, especially in ensuring healthier food options and in reducing the harmful use of alcohol and tobacco. National programs have been launched under my purview to address both issues. The challenges we face today cannot be overcome by just one person or institute. It is important that all stakeholders come together when finding solutions and implementing them efficiently. As Sri Lanka has strengthened its fight against NCDs, to be successful, we need international support and technical assistance from WHO. I thank Dr. Tedros for prioritizing NCDs and setting up this commission. Its relevance and benefits are already evident. I hope to see many of you in September in New York for the high-level meeting. Thank you.
I want to recognize the presence of the Ambassador of Sri Lanka here in the room, and please convey our thanks to the President for his support to the Commission. Finally, I want to turn to the last co-chair of the Commission, the Russian Federation. The Minister of Health, Veronika Skortsova, has just been reappointed and is today in the Russian Federation. She also sent us a video message which will be introduced by Ambassador Gennady Gatilov.
Mr. President, Director General, distinguished colleagues, it's a great honor to take the floor before you. Countries of the world, despite of their national income levels, infectious diseases are not only the main reason for death, but also one of the key factors that are preventing sustainable development. On the basis of experts of the International Economic Forum, if we don't take additional measures today, the loss due to NCDs could, by 2030, represent $45 billion, which is in line with about 35% of world GDP. Russia is a leader in the fight against NCDs in the world. Our country, in 2011, organized the first global WHO conference on healthy lifestyles. In the preparation of last year in Montevideo, we took part in the conference on the fight against NCDs, the success of which is shown in the services of President Dr. Vasquez. We intend to continue to support multilateral efforts to counter infectious, non-infectious diseases. Russia was grateful to take up the invitation of Dr. Tedros to take part as a co-chair on the panel on NCDs. We are convinced that the recommendations prepared by the Commission that we have been presenting today will be a strong basis for the meeting that will take place in November in New York, the high-level meeting on NCDs. We think this will be an important contribution to achieving the objectives of sustainable development, inter alia, the objective number 3, ensuring healthy lifestyles and ensuring the well-being of all people throughout their life cycle. Distinguished colleagues, unfortunately, due to objective circumstances, the Minister of Health of the Russian Federation, Veronika Skortsova, could not take part in the meeting today. However, she has prepared a video statement that I would draw your attention to now. Please start the video. Director General of the WHO, co-chairs, members of the Commission, dear colleagues, let me welcome you on behalf of the Russian Federation and all the medical community of our country. NCDs are truly a complex problem and requires an interdisciplinary approach. it touches upon all areas of economics and life. NCDs is the main reason for mortality and morbidity throughout the world, and it's important for the WHO and the international community to address this issue in all countries. The experience of Russia in fighting NCDs demonstrates that the development of preventive measures and preparing the population for healthy lifestyles can help us reduce NCDs and mortality from them. In 2013, we started to screen the population. A great deal of work has been carried out to reduce NCDs and the risk factors associated with them. Also, providing information to the population. Today we see the fruits of our efforts. The life expectancy of people of the Russian Federation has achieved a historic levels. Death from NCDs has been reduced. We have seen a reduction in the alcohol abuse. In tobacco use has dropped by 22%. And the number of individuals who are taking part in sport-related activities has increased tremendously. We know that the starting point of this process required us to unite efforts. And we understand that it was important for member states to support. And this all was kicked off at the special meeting in 2011 at the meeting hosted here in Moscow. This was the first global conference on healthy lifestyles and the fight against NCDs. The high-level commission had noted that the proposals, the most effective measures against NCDs have been adopted. We are convinced that today's high-level meeting will allow us to consolidate the position of all members of the international community on the basis of the declaration of the General Secretariat. We think that this upcoming UN event will be undoubtedly a very important highlight. Thank you.
Thank you very much, Ambassador. Spasiba. Please convey also our thanks to the Minister for her message and the strong support of the Russian Federation for more than a decade now to the NCD agenda. We have one last statement, which, as you know, WHO has a WHO Global Ambassador for NCDs and injuries, Mr. Michael Bloomberg, who's very active in the field and has sent also a statement by video on the report.
Hello. Non-communicable diseases are too often considered an unavoidable problem, but nothing could be further from the truth. Not only are they largely preventable, but we also know what measures are the most effective in saving lives. And those measures tend to be both cost-effective and replicable. So what works in one country can be applied in many others. We all know that's not happening enough, but this new report can help to change that by making the case for action. We have the potential to save countless lives, particularly in low and middle income countries, while also strengthening local economies. This report charts a path forward, and all of us at Bloomberg Philanthropies look forward to working with you to implement its recommendations. Thank you for your commitment to this work, and all the best for a productive launch and year ahead.
I wish we now had time for some discussion as was planned initially, but we're already way over time. So I'm afraid it's better we move on towards the last step of this meeting. If Richard Horton was here, we probably wouldn't be over time. But then he would turn to DG and say, so, Dr. Tedros, You now have the report of your commission. What's next? Something like that. Dr. Tedros, please.
Yeah, it's actually great how many languages you speak. Your Latin, actually your Spanish, sounded really great. And then Russian too. Okay, so thank you so much. At least I know the thank you part of Spanish, Russian, and other languages, including Finnish. Yeah. First of all, Your Excellency, Dr. Taberes Vasquez, President of Uruguay, and my brother, I would be honored to call you my hermano. Excellencies, co-chairs and the commissioners, ladies and gentlemen. First of all, thank you for being here today for the launch of this report. And a lot has already been done, so I will keep has already been said, so I will keep my comments as brief as possible. But I would like to start by thanking the co-chairs and all commissioners for their commitments. Co-chairs, President Maithripala Sirisena, President of Sri Lanka, for joining us through video, and also my sister Pirkko Mattila, Minister of Health of Finland, and through another video message, Veronika Skorsava, my sister, the Minister of Health of Russian Federation, and of course the force behind this commission, my good friend and sister, Dr. Sania Nishtar. So thank you so much indeed. By the way, I would like to use this opportunity especially to thank Russia for your new funding for NCDs. That shows a real commitment. And I would like to say spasiba for this very, very generous support, which amounts around $50 million, which we haven't announced before, but I would be honored to announce it today. And to commissioners and co-chairs, you have done a lot of work in a very short period of time. I know it hasn't always been easy, but I appreciate your hard work and the negotiations. As you know, NCDs are one of our 5 priority platforms in WHO's new General Program of Work, which was approved just last week at the World Health Assembly. And we had a good reason to make it as our priority in the GPW because, as you know, 41 million deaths per year are due to non-communicable diseases, and 15 million of those between the ages of 30 and 70, which is premature deaths due to NCDs. And the Sustainable Development Goals actually set a target for NCDs, as you know, on premature deaths to cut by 1/3 by 2030. But at the current pace, we will miss that target. And that's why I like this title, Time to Deliver. I believe that we can catch up if we can really speed up all the things we do with regard to the fight against NCDs. But I would like to reiterate again that with the current pace, we will miss the target. So it's time to speed up and deliver, and the right recommendations, of course, from the NCDs in that, from the commissioners in that respect. And I'm hopeful that this Commission's recommendations will accelerate the action that's needed to turn the tide on NCDs and mental disorders. I'm pleased to hear that these Commission's recommendations are aimed at heads of state and government. We need political commitment from the highest level to achieve significant change. The recommendations of this report are ambitious, and implementing them is not a job that ministers of health alone can do. I know this because I was one. Ministers of finance must be engaged, but they cannot solve this enormous problem alone again. Heads of states and government must take responsibility for action on NCDs in their own countries. They must bring together all sectors and stakeholders to work together. That's why I'm so pleased that His Excellency, President Vasquez, is here with us today, a real hero in the fight against NCDs. And I would like to say congratulations again for the award yesterday and for your strong leadership on NCDs. Your presence today already says tons. I don't need to really say, but my appreciation is beyond words. And please accept, Your Excellency, my greatest respect and appreciation. As you know, the President has shown great leadership in his own country and globally, as we saw when he hosted the Global Conference on NCDs in Montevideo last year. Thank you once again, Your Excellency, for your leadership and your commitment. I hope that many other heads of states will follow your example and will attend the UN General Assembly high-level meeting on NCDs in September. Ladies and gentlemen, there are practical recommendations in this report that will enable all countries to take action now, in particular the one on prioritization. Although countries have committed to taking action on NCDs, we have to acknowledge that many are simply overwhelmed by the number of things we are asking them to do. Identifying a few specific priorities is the right thing to do, and it will give countries experience and confidence to scale up. I'm also pleased to see the recognition that services to prevent and treat NCDs must be embedded in national plans to strengthen health systems and achieve universal health coverage. Strong health systems based on people-centered primary care are the best way to prevent NCDs and to detect and treat them at the earliest stage. We have long experience in managing diseases like HIV and TB using models of chronic care. As the report notes, these same models can be used to prevent and manage NCDs. Once again, I thank the co-chairs and commissioners for their hard work, collaboration, and concrete recommendations, and I welcome this report. But this is not the end point. Our next challenge is to translate these recommendations into action. You can count on WHO support for that. And under his leadership of President Taberes, we had a meeting of the co-chairs, and we discussed on the way forward. Of course, that should include also all commissioners to concretize the way forward in relation to the recommendations. But this, but this is not the end point, as I said earlier. That's why we're discussing about way forward. Our next challenge is to translate these recommendations into action. I have appointed the Commission to run until September 2019, as you know. And in the coming year, I expect the commissioners to act as advocates for implementing the recommendations at country level. Country level is where the real fight happens, by ensuring ownership by the countries themselves. That will be the true measure of success. And before I end, I would like to thank Zolega Mandela. By the way, there is K, but when you read it, it's not Zolega, it's Zolega. Zolega Mandela. I'm very proud that you're with us and for sharing with us your own story, which I was so moved actually to hear about it before I met you yesterday, and we met yesterday, and your enthusiasm and passion was very infectious. So thank you so much for infecting us with passion and enthusiasm and commitment. I have seen the real commitment that you have, and we are ready to work with you very, very closely. And thank you so much for all you have done, and also for the commitment you have shown, even to do more. So Zolega, thank you so much. And there is also a good reason now, when you're amongst us, to remember your grandfather, Madiba Mandela, the greatest man on earth, who influenced the whole world, and through his actions, his leadership. So thank you so much for joining and for following your grandfather's footsteps. You're courageous and fighter, and that's what he was. And thank you so much to have you amongst us. Then to all co-chairs again, muchas gracias, Your Excellency, Spasiba, Kitos, and Obata Sutiti. That's Sri Lankan, by the way. Thank you so much. Thank you.
Thank you very much, DG, for your remarks. Developing the report was hard, but the hardest part is to come in the next 5 minutes. My colleagues think we can take a group photo of so many people in 5 minutes. Shall we try? I would like to invite everybody as a sign of support for the NCD action and for the implementation of the recommendations to run outside and stand on the stairs just outside there for a group picture. Thank you very much.
Very good.